We're recording. Going to go live. There he is. All right. Mike, we're going to get started now. I'm going to let everybody in.
Hi, everyone.
Hi.
Hello.
Right, you ready to dive in here? Mary O'Leary, I think you beat the independent this time. Okay, so yesterday we had 16 confirmed cases. Today we have 29. So as you can see, the spike is beginning to happen, and our team is working very hard to respond as fast as we can to the situation. We, of course, anticipate that number to grow, and also suspect there are many more cases than the ones that we've identified as COVID positive in the city now. I also have I'm going to share the bad news that we lost one of our New Haven residents today. This is the first New Haven resident that's died because of COVID-19. Additionally, we have one positive case at Bella Vista. The individual was at the hospital today and will be transported back to Bella Vista, where the individual will be self-isolating and be monitored by staff. I wanted to note on this site, there's a couple thousand residents that live at this site, and Carabetta, the management company, has had difficulty getting everyone to follow the directions where they're not supposed to. They have a policy of no visitors, except for exceptions for healthcare workers and other support staff. So I really want to encourage people to not visit nursing homes, to not visit areas where there are a large number of seniors or vulnerable populations that are living, because they will be putting their relatives, their friends, their family members at risk. A couple of other updates. There were, on yesterday's call, I mentioned that there were a handful of firefighters and police officers that were being tested. It's important to clarify, because there was some social media, not from you all, I believe, but from other folks that said that those public safety officers had tested positive. That's absolutely not accurate. The two firefighters that were tested yesterday, those tests came back negative. We're very relieved to get those test results and to make sure that we've got the firefighters coming back to work and that they're safe. There's several other firefighters and police officers that are being tested now, and we're waiting for those results. I also wanted to mention that I'm very grateful to the Yale New Haven Hospital, who's been working with us since the incident where an individual left before being released from the hospital. That individual had tested positive for COVID-19, and the press is very well aware of that incident. The hospital's been working with us to increase security on the site, to lower any potential that a COVID positive individual will leave before being discharged. A couple other updates. School meals distributed yesterday was 5,400, a little bit over 5,400. And Dr. Tracy and her team have been working very hard to get up and running the online learning program. And I suggested that Dr. Tracy join the call because I think it's the work that her team has been doing with some serious logistical challenges and equity challenges is admirable, and I was hoping that she could take a moment to share some of the updates on the work around the online learning. So Dr. Tracy?
So thank you, Mayor Elicker. I hope this message finds everyone in good health at this point. So Monday, Governor Lamont announced that all schools across the state are closed through April 20th, 2020, and it may be extended much further than this date. As you know, everything is fluid and continues to change. Whenever there are changes, I'll be in touch with all my families, including the mayor's office. We are gearing up to launch our online learning activities on Monday, March 30th, 2020. My team has been working hard to ensure that there are continued learning opportunities for all our students. It may not be perfect, so we're asking for everyone to please be patient with us. Teachers will be in contact with their students throughout the week to check in with families and provide support. We have done what we call a big survey of our students, of our families. About 12,500 responses were received. And this survey indicates that over 70% of our students do not have laptop or computer and other computer devices at home. As a result, we distributed over 5,500 electronic devices to date for our students. I'm pleased to say that I am on a task force with the governor and Commissioner Cardona and a couple area superintendents to ensure equity of learning opportunities for students as it relates to high school students and for aligned school districts. Our Chromebook distribution continued to provide support to our children. We know that some of them may not have the devices they need. We're trying the best we can to support our families. We also have to make sure that where there are no devices, we're also providing some other supports for our students. We have distributed 5,500 today. Communication with our staff is very important, and with our parents. So we have been using emails, we've been using parent links, and we have been doing all that to make sure that our students are supported. We're also taking care of the physical pathway in terms of food distribution. My COO, Mr. Pinto, reported that to date, there are about 35,000 meals that have been distributed since we started. Please know that my major concern right now is the health and safety of our children and families. I know that many parents are concerned about graduation requirements for our seniors. Please note that only the state can determine whether or not there's a waiver for requirements. As soon as we get that information, we'll make sure that all parents and all graduates, seniors, are informed about what we do. Finally, I know that this is a stressful time for our students and families. Please be sure to take care of yourself and do something fun with your children. We all need some fun to de-stress. Thank you.
Thank you, Dr. Tracy. I also know that the New Haven Independent had a question about the census yesterday, and I wanted to ask Mike Piscatelli to just give an update on our thinking around the census.
Sure. Thank you, Mayor. Thank you for the question as well concerning the U.S. Census, which is ongoing. As everyone knows, Census Day is April 1st, and that's heavily impacted by the current pandemic. It's very important to New Haven. We generate about $2,900 per person in New Haven in federal funds associated with the census. Our Complete Count Committee is moved completely online now, so they are doing virtual training to help people with outreach and direct peer-to-peer connections. We did 35 people trained last night. We have 80 Latino pastors in training today. As you may have heard from other outlets, the Census Bureau has adjusted its schedule. So they moved the schedule back about 2 weeks. Outreach, the census workers that were being hired, they were going to start on March 30th. That'll slide to April 13th. It might slide again. But what was very important to New Haven, the overall count deadline is now shifted to from July 31st to August 14th. So it gives us a little more time this summer. And all college students, a ruling came down from the Census Bureau that all college students will be considered on campus on April 1st, which, as you know, is very important to our region, which has over 40,000 college students. In terms of the response rate so far, nationally, 26.2% of the households have returned their forms, either online or by phone or by mail. In Connecticut, 26.9% have returned forms. New Haven is at 20%, which is very healthy for a center city. all of Connecticut's center cities are now between 16 and 30%. So we'll keep working it, but obviously now online.
So I think that's up for our updates, unless Director Bond, Chief Alston, Chief Reyes, or Mr. Pinto have anything to add.
I'm good. We're just working on, new and, trying to, in support of the Chromebook, making sure that we also have Wi-Fi access and whatever creative ways we can find to do that.
Okay. So why don't we, did you want to share something, Director Bond?
Just going to defer to the questions.
Okay, why don't we go to any questions that folks might have? All right, let's go with Shana.
Thank you for taking my question, Mayor. I know you mentioned the first death, unfortunately, in the city. Do you have any idea, can you speak to how old this person was?
I'll defer to Director Bond.
So yes, so at the health department as a team, we actively are not only trying to identify the positive cases, but we are also working closely on trying to have contact tracing. And so when we learned of his untimely death, we were saddened, and we send our condolences to those individuals that are family and friends and coworkers. And so I just want to first make that disclaimer because we know that many people are affected by his untimely death. The individual, it was in his late 50s, and so that is the age group that I reported last week in regards to that particular case.
Now, Director Bond, there have been some concerns really in the city as far as a worry for undocumented people and the fear that they may not report symptoms or go get treatment for fear of any immigration repercussions. Can you speak to that, and if there are any rights associated with a pandemic of this size and the large undocumented population that relatively is around this area?
Yeah, so for us and many partners, and we've discussed this with local partners, this is affecting all people. We are trying to ensure that we are providing that support regardless of documented, regardless of their status of residency. So it's important, and we've been trying to do that in our messaging, that individuals that if they portray symptoms, they can please call their local community health center, who can provide support. Our health department can also issue orders that will then allow them to get tested. And the hospital, of course, continues to provide support and has indicated that there will be no charge to the test. And so we encourage individuals that are presenting any symptoms to please feel encouraged to call our hotline at 203-946-4949.
Gotcha. So
if I could add to that, so we've done a lot of messaging in English and Spanish, and as many know, many people in the undocumented community are Spanish speakers. We've also been working to increase outreach to the undocumented community. We've partnered with some community leaders, including Kika Matos and John Lugo, who have pushed out some Spanish language outreach to make sure that the undocumented community understands what to do if they have symptoms, who to reach out to. And I was on the phone with Fairhaven Health Clinic this morning, and they're helping make sure that they're a trusted community resource, helping make sure that people know what to do, who to contact, and are also able to provide prescriptions, as well as New Haven Health Department is, to make sure that people get tested.
I think part of it is also just hearing the words from people like you and Director Bond that there shouldn't be any fear. And I think a lot of people are fearful in a situation like that. So can you kind of speak to the rights that they have and the need to not be fearful if that's the case?
Yeah, New Haven has always been a place that's welcoming of so many people, no matter what they look like, what their economic status is, or what their document status is. And now is a time more than ever where someone's economic or physical attributes have nothing to do with the fact that we need to work together as a community everyone has a responsibility, and we need to make sure that everyone has the resources that they need to protect each other. And we are, as a city, working as hard as we can to reduce any barriers to people having access to the care and support that they need during this time.
Absolutely.
Ask about the first fatality, and it is very sad news. I'm sorry to
Just
hear
one,
that.
one sec. Shane, are you all set with your?
I just had just one more question. Have you given any more thought of releasing the names of the facilities of where people have tested positive?
Yeah. So again, I don't want to make the disclaimer each day, but you know, I have to really just be respectful and not raise any potential inequities of compromising the individuals that are affected. And so we are working very closely with those individuals that are impacted, and as well doing contact tracing, so that we can ensure that we're mitigating this as much as possible.
But I'd add to that you know, I made a deliberate decision to share that Bella Vista had a case. There's about 2,000 people that live there, but also it's very important from a health perspective, we believe, to make sure that Bella Vista residents are taking very seriously their role in reducing community spread, and also taking very seriously the importance that they need to follow directions to take care of themselves as well.
Thank
That
you.
actually was
So-
going to be my question for Bella Vista with the.
So Paul had a question, and then I'm happy to go to you, Ms. Jones. Sorry about that.
No problem. Thank you. So my question is about the two, and I'm very sorry to hear about both these cases. If we know how this person in his 50s contracted the virus, and if he had underlying conditions, and this Bella Vista case, how old is the person and where is the person now?
Director Bond, do you want to respond?
Sure. So the first
Thank you.
so the first question in regards to the individual that passed away, he was in his late 50s. He was not, the onset symptoms were unknown where the risk of exposure occurred, because the individuals worked in several sites and interacted with many people. And so we know when the onset of the symptoms occurred, and so and yes, he had underlying medical conditions that added to the contribution of being able to recover. The second individual should be getting discharged as we speak, was in the hospital overnight, tested positive, and is also an older individual.
And just to be clear, that individual will be transported back to Bella Vista and will be self-isolating there.
And I provided recommendations on the best way to get them back into the unit without increasing exposure to other individuals.
Thank you.
Yeah. Kyle, sorry about that. Now I'm having trouble unmuting you.
Sure.
There you go.
No problem. So you kind of spoke to it a little bit. I was going to ask, given the population at Bella Vista, are there any extra precautions that are being taken to make sure that that population tries to remain as unaffected as possible? And are there any extra support that you guys might offer there?
So I'll take a stab at it, and then maybe Director Bond can add to this. We've had multiple conversations with Carabetta, which is the management company for Bella Vista. They have done a number of things to improve their ability to protect the residents, and it's everything from increasing the cleaning of the facility to putting up posters advising residents on what to do to keep themselves safe, to creating a robocall system so that they can quickly communicate with residents if there is the need to. We've also talked to them about the visitor policy, and they have a policy now of not accepting visitors unless there's a health worker, or if there are organizations bringing food, things like that. They've done a number of things to increase protection. We're in ongoing conversation with them to see if there's other ways that we can keep the community safe. Director Bond, I don't know if do you have anything to add to that?
I think in addition to what Mayor Elicker just shared, We also provided a webinar where we actually facilitated a webinar for all multi-unit facilities that are similar to Bella Vista, providing recommendations and also advising them about their protocols. And so it is important that not only should Bella Vista be taking the necessary precautions, but we need all multi-unit apartments that house elderly and persons with disabilities to really be assessing their protocols and what they have in place to, provide those measures to reduce the risk of COVID-19 with their residents.
I will also be doing a robocall to Bella Vista tonight, just to underscore what people need to be doing to make sure that they take care of themselves.
Okay. And my second follow-up question was with the gentleman that had passed away. I know you guys mentioned that he interacted with many, many people. Is there a concern there? I know with coronavirus, it's going to spread, but is there a concern, an immediate concern with how many people that he was in contact with?
When we made the assessment of the contact tracing, those individuals that had prolonged contact were advised to do some self-monitoring. And we are working closely with that facility and are in contact daily. And so currently we are monitoring that closely, and we'll provide any updates. I have a call with them this evening to discuss any potential updates or concerns that I need to be made aware of.
Other questions? Anybody?
Mayor, it looks like Mackenzie Hawkins raised her hand. I don't know if she's dialing in.
Mackenzie?
Hi, yes, my webcam doesn't work, but I am dialed in. My question is, you mentioned that you're working on increased security at Yale New Haven Hospital, and I'm wondering what exactly that looks like and if there are any specific plans in place.
So my understanding from my conversation with them, and Chief Reyes, if you have any additional information, is that they're increasing the security at the entrances and exits to make sure that if there's anyone that's a flight risk, that individual is not going to be able to leave the facility, and that they'll quickly notify the police if there is any, New Haven Police, if there is any major issue. Chief, did I get that right? Do you want to add anything there?
No, yeah, that's exactly right, Mayor. The only thing I would add is that we have been in close communication with the hospital security staff, the director there, Director Proto, to improve communication between agencies to make sure that that things aren't slipping through the cracks in terms of individuals leaving without us knowing.
Other questions?
I have a question. Can you hear me?
Yes.
Okay. Actually, I have the question about the security. So the increased security or better protocols is on Yale's security system, and then they will contact police if there's any incident or similar to what happened.
Correct.
All right. I also had a question for Mike Piscatelli, if he's still on.
He is.
Okay. Just wondering how the sort of day-to-day business is going with, and there's going to be a city plan meeting tonight. If things are relatively normal, I think one of the new apartment buildings on Union Street, they were supposed to start laying concrete very soon, if that's on schedule, or permitting is on schedule.
Well, nothing is normal. Certainly, both city plan, building, and economic development, the staff is by and large working. Construction is active. That particular project, they actually were in to pull the permit and keep working. So we have inspectors following safe practices and doing the inspections. City Plan Commission tonight will be our first digital meeting. We're following the new protocols that were set forth by the state. There was a big conference call with the land use commissions and the attorneys earlier today to go over those protocols. And we're looking forward to it going as well as can be given the circumstances.
Thank you. So now, just to reiterate, there was 18 people, I guess, in the city, and unfortunately one fatality.
I'm sorry, 18 people that
contracted coronavirus?
So as of today, we have 29 individuals that have tested, or 29 COVID positive cases.
All right, and that the jump in those numbers is just because the testing came back. I guess it takes a while to get the test back.
Yeah.
I mean, that's a big jump from yesterday, right?
Yes, I would suspect it's a combination of testing coming back and community spread.
Yeah. As of today, across the state is 900 cases, 19 fatalities. So the numbers are now starting to significantly increase, as you can imagine.
All right. I also talked to Yale New Haven Hospital today, and they seem to be confident that they will have enough beds, or they have, they freed up beds because they don't have elective surgeries, and people have, and they're looking for other alternatives. But there's nothing else with the city, right, for suggesting an alternative where they could set up more beds if needed.
So my understanding is that the state is working to identify sites for a surge in bed needs. And we are interested in helping the state and the hospital in any way possible to support that effort.
I mean, I saw the St. Francis Hospital actually had the National Guard, I guess, help put up an addition or another site there to help. But do you know if there's any planning for that?
At the moment, there's no plan for the National Guard to put up additional hospitals, such as what has happened, I believe, in Danbury, or what is happening in Danbury and Hartford, is my understanding. The hospital has said that they believe they have a good plan, but of course, we're monitoring that and happy to help in support that effort to help them expand if they need to.
Thank you.
Yeah. Any other questions? All right, we'll go to Shayna, and then maybe Paul.
Mayor, any update on the Hill Regional Career Site? Have you had any use of it yet? And are you still kind of scoping out other potential areas in the city in preparation for the overflow?
So we still plan on using the career site. There's no major updates. We've confirmed that there are separate HVAC systems for the gym and the rest of the school. We've always been planning on cleaning the entire school after use of the facility is complete. But the fact that there's a separate HVAC system is just another, I think, a piece of information that will put some community concerns at ease. Our main two challenges with standing up this site that we're working very hard on are PPE and staffing. And our team is every morning in our morning meetings, this is a major topic of conversation because we're working very hard to get it going. For very obvious reasons, that we want to make sure that we're allowing the hospital to have enough vacant beds for new patients that actually need intensive care. And this facility can help alleviate some of the pressure on the hospital by allowing the hospital to release people that are not sick enough to be in the hospital, but that test positive for COVID-19 and don't have another place to go.
Thank you, Mayor.
Yep. I saw Paul Bass has a question.
Yeah, I just wanted to thank you for holding these briefings. You guys have worked like crazy, and you take your time every day to help us get our questions. So you're doing a good job on that. Thank you.
Thank you.
Thank you for saying thank you. Any other questions? Mary's kind of waving. Do you have another question, Mary? Or are you good?
I do have a question.
I thought
so. It was a nice story today on Pedro Soto's business stepping up and helping with hospital needs. Are there any other companies? His company is no longer in New Haven, but he is a New Havener. Any other companies in New Haven helping to do that, helping to make masks or anything else that the hospital needs?
I don't know if Mike maybe has some answers to that. One thing to note is that Make Haven has offered to try to help in the effort, and they've had some initial exploration of ideas like sanitizing masks through, I think, UV. You need to check with them to confirm that. and potentially producing masks through some 3D printer or something like that. But I would check with them before reporting any of that, because I want to make sure that the information is accurate. Mike, do you have anything to add?
No, would have referenced the same. J.R. Logan at Make Haven has been pulling together any inquiry concerning PPEs, and they've done some training and workshops. And if something comes of it, and we don't hope it will, coordinate, just check with J.R. to see how that's going along.
Thank you.
Thanks, Marianne. It's nice to give a shout out to your competitor there in the Independent for their good article. Any other questions?
Mayor McKenzie has her hand up again.
Oh, thank you, Chief.
Yeah, thanks so much. I was wondering if you could speak a little bit to how all of this will affect the budget negotiation process. I know that Lamont waived the requirement for town meetings and that New Haven had several in-person meetings scheduled to talk about the budget with residents. What will that look like going forward?
This is actually a really good question. And I'm very grateful that we have daily calls with I have daily calls with the Board of Alders leadership. And the Board of Alders has expressed a willingness to work with us to get through this budget process. The budget process is complicated on two fronts. One is making sure that the community has enough opportunities to express any concerns they have or voice any questions. And also our department heads have the time and ability to provide adequate information to the Board of Alders for the hearings. As I'm sure you know, anyone that's watched New Haven's budget process, it takes a lot of time on our department side to prepare for these hearings, and we're working very hard on a lot of other issues, and the Board of Alders has expressed a willingness to work with us on that. We do have a budget hearing scheduled, I believe, for next week. And the second component that's complex is that there will be many ways that this crisis will impact this year's budget and next year's budget. Some of those that we feel that we are starting to understand, and others that we don't fully understand yet. And so the budget process, the budget itself is a little bit of a moving target because we're not quite sure what the economic horizon is for the city. Does that answer your question, Mackenzie, or do you want to raise your hand again?
No, that's good. Thanks so much.
Okay. Anything else? Thanks so much, oh, we got one more.
I know you went over it at the top of the press conference. Could you just go over the numbers for the firefighters who were tested and were waiting for the results, and then the number of the ones that came back negative, and if
Chief,
the police department is impacted at all?
So why don't I just defer to Chief Alston and then Chief Reyes?
Sure. Thank you, Mayor. So yeah, there were 4 firefighters who felt uncomfortable and were feeling ill, if you will. 2 were tested, and we want to thank Director Bond for getting the test expedited, and they came back negative. We're waiting for the other 2. The other 2 are isolated. They're not on duty, and we're just concerned and supporting them and their families as we wait for those results.
Okay.
Chief Reyes?
So we also had 2 officers, one who contacted us was not symptomatic, but does have a spouse who tested positive, and she's a healthcare worker. And so he wanted to take the precautions of staying home. And so he's self-isolating, and we're working with Director Bond to make sure we monitor him, but he's asymptomatic at this point. Another officer who was on his days off right prior to coming back to work, he was feeling symptomatic, went to his doctor, tested negative for the flu. So we decided to have him tested for COVID, and those results are pending. We anticipate they'll be coming in any moment now, and we'll report that out. Those are the 2 that that we reported.
Okay. Thank you.
Thanks, Chief. All right, everyone. Thanks so much for joining, and we'll probably see you all again tomorrow. Take care.